Why patients with Crohn's are susceptible to renal stone? Because of Crohn's disease, there is malabsorption, so increase intestinal fat, and it binds with the calcium, so increase oxalate, living oxalates, and they pass through the urine as hyperoxaluria, and it increase the chance of oxalate stone formation. Oxalate stone formation again increase intestinal fat due to malabsorption, bind to calcium, leaving oxalate, hypercalciuria, hyperoxaluria. Beside the GIT, what are the other system involved by inflammatory bowel disease? এখন জিজ্ঞেস করতেছে extra intestinal manifestation. Beside GIT, what other system affected by IBD? এটা হচ্ছে স্কিনে pyoderma gangrenosum and erythema nodosum. PGEN, English PG. Erythema nodosum, pyoderma gangrenosum. Erythema nodosum, pyoderma gangrenosum, and in eye, iritis, conjunctivitis, episcleritis, anterior uveitis. Eye, iritis, conjunctivitis, episcleritis, and anterior eyes. Eye, eyes. Okay. Skin হচ্ছে ইংলিশ পিজি। erythema nodosum, pyoderma gangrenosum. আইতে হবে anterior uveitis, iritis, episcleritis, conjunctivitis. Anterior uveitis, iritis, episcleritis, conjunctivitis. লিভারে হবে স্ক্লেরোজিং কোলাঞ্জাইটিস, লিভার স্ক্লেরোজিং কোলাঞ্জাইটিস, জয়েন্ট আর্থ্রাইটিস, লিভারে স্ক্লেরোজিং কোলাঞ্জাইটিস, জয়েন্ট আর্থ্রাইটিস, in the finger clubbing, oral cavity, aphthous ulcer. তাহলে আবার কি extra intestinal manifestation of inflammatory bowel disease. The skin, erythema nodosum, pyoderma gangrenosum. Eye, anterior uveitis, iritis, episcleritis, conjunctivitis. Liver, sclerosing cholangitis, joint arthritis, finger clubbing, and oral cavity, aphthous ulcer. What is the most common extra-intestinal manifestation of IBD? Arthritis. Most common extra-intestinal manifestation of IBD is arthritis. How would you investigate a patient with suspected ulcerative colitis? এটা হচ্ছে ulcerative colitis. Investigate কত বলছে? Full blood count এখানে পাওয়া যাবে macrocytic anemia. Full blood count, macrocytic anemia. Ulcerative colitis, macrocytic anemia. Stool analysis for fecal calprotectin and fecal occult blood. Fecal occult blood. Again, full blood count পাওয়া যাবে macrocytic anemia. Full blood count, macrocytic anemia. Stool analysis, fecal calprotectin and occult blood test. Barium follow through X-ray. এটাতে পাওয়া যাবে feeling deformity, feeling irregularity, and CT. Barium follow through X-ray and CT. প্রথম বিন concentration to detect vitamin K, কারণ লিভার impaired হবে, liver function test. ADEK, vitamin K dependent floating factor গুলো 2, 7, 9, 10. Colonoscopy but not in acute phase. Okay. Full blood count আমরা পাবো macrocytic anemia. Stool analysis এর জন্য করব calprotectin and occult blood to rule out any colon carcinoma. Barium followed through X-ray and CT prothrombin concentration to detect vitamin K deficiency, colonoscopy, but not in acute phase. What are the vitamin deficiencies to be expected in IBD? Vitamin deficiencies to be expected in IBD হচ্ছে ভিটামিন এ ডি ই কে, কারণ কে ডেফিসিয়েন্সি হওয়ার কারণে এগুলো হবে। এ ডি ই কে ডেফিসিয়েন্সি এন্ড বি12, এ ডি ই কে এর নিচে থাকবে বি12, ADEK and vitamin B12. Does the patient need endoscopic surveillance? Yes, patient need endoscopic surveillance for the risk of colon cancer, to exclude colon cancer. Yes. How could you treat a patient with Crohn's disease, ulcerative colitis and Crohn's disease? এখন জিজ্ঞেস করতেছে সিডির কথা, Crohn's disease, ulcerative colitis, সিডি, Crohn's disease। Crohn's disease কিভাবে আমরা ট্রিটমেন্ট করব? ফার্স্ট, কনজারভেটিভ ট্রিটমেন্ট অফ Crohn's disease মেডিসিনে তারা কি করবে? ফার্স্ট, লাইফস্টাইল মডিফিকেশন, দেন dietary control, low residual diet, lifestyle modification, low residue diet, lifestyle modification, low residue diet, lifestyle modification, low residue diet, lifestyle lifestyle modification, low residue diet, lifestyle modification, low residue diet, lifestyle modification, low residue diet, lifestyle modification, lifestyle modification, low residue diet, and advice from gastroenterology modification, which may include medication which may include steroid, antibiotic according to the trust policy and microbiologist, 5 aminosalicylate acids and immunomodulators, and third, আমরা কি দিতে পারি? মেডিকেল ট্রিটমেন্ট, ইফ মেডিকেল ট্রিটমেন্ট ফেইলড or resistance case, in case of some complication, go for surgery। আমরা কি কি সার্জারি, তাহলে আবার কি দাঁড়াইলো? Crohn's disease ট্রিটমেন্ট হচ্ছে লাইফস্টাইল মডিফিকেশন এন্ড ডায়েটারি কন্ট্রোল, স্টার্ট উইথ লো রেসিডুয়াল ডায়েট, then advice from gastroenterologist and medications like steroids, antibiotics according to trust policy and microbiologist, and immunomodulators, and 5 aminosalicylate acid. Thirdly, if medical treatment fails and not responding, then we can go for the surgery. What are the indications of the surgery? Relapse, refractory to disease, and intestinal obstruction। আমরা পড়ছিলাম ওখান থেকে হইতে পারে কি টক্সিক মেগাকোলন, ইন্টেস্টিনাল অবস্ট্রাকশন, অ্যাবসেস, ওইগুলো। তাহলে টক্সিক মেগাকোলন, ইন্টেস্টিনাল অবস্ট্রাকশন, অ্যাবসেস, ফিস্টুলা, পারফোরেশন, হেমোরয়েড এন্ড ক্যান্সার, এন্ড রিফ্র্যাক্টরি টু ডিজিজ, মানে সব হচ্ছে কমপ্লিকেশন। যখনই ডেভেলপ করবে তখনই আমরা সার্জারির দিকে যাব। ওকে, এন্ড হোয়াট ইজ টিএনএফ? টিএনএফ হচ্ছে টিস্যু নেক্রোটিং ফ্যাক্টর। টিএনএফ,
It's the food that brings you back to that safety net. It's like time.
What is TNF? TNF is tissue necroting factor. This is a pro-inflammatory. It is a pro-inflammatory cytokine secreted from the macrophage. TNF from the macrophage. Yes, Mac TNF, TNF from the it is secreted from the macrophage and is a pro-inflammatory cytokine. Is a pro-inflammatory cytokine. It is a pro-inflammatory cytokine released from the macrophage, involved in systemic inflammation, involved in systemic inflammation, and in making up acute phase reaction. Again, TNF is a pro-inflammatory cytokine which is released from the macrophage, involved in systemic inflammation, okay, এখন ফাংশন, রিলিজ হয় ম্যাক্রোফেজ থেকে। সুতরাং অ্যাক্টিভ ম্যাক্রোফেজ এন্ড নিউট্রোফিল, সে ম্যাক্রোফেজ এবং নিউট্রোফিলকে অ্যাক্টিভ করে। টিএনএফ 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 এটা ম্যানকে অ্যাক্টিভ করে। টিএনএফ অ্যাক্টিভেটস ম্যাক্রোফেজ এন্ড নিউট্রোফিল। তারপরে কোফ্যাক্টর ইন activation of T cell, cofactor in activation of T cell, cofactor in activation of the T cell, mediators to body response to gram negative septicemia, gram negative septicemia, mediators to body response to gram negative septicemia, anti-tumor effect, TNF and নামই হচ্ছে anti-tumor, so anti-tumor effect and similar to interleukin 1. Again, TNF, it activates macrophage and neutrophil, it activates T lymphocyte or T cell, it has anti-tumor effect and it is similar to interleukin 1, and it activates or it mediators to body response to against gram-negative septicemia or bacteria. What is the rule in inflammatory bowel disease? What its rule in inflammatory bowel disease? IBD. TNF এর rule in IBD তে। এটা কত বড়! What is the rule in inflammatory bowel disease? TNF direct epithelia to increase tight junction permeability. TNF direct epithelia to increase tight junction permeability, which increase the flux of luminal bacterial component, which activates innate and adaptive immune response. Activates innate and adaptive immune response. What is the inflammatory? What is the rule in inflammatory bowel disease? They activates innate immune response and adaptive immune response, which activates TNF direct epithelia to increase tight junction permeability. একটা লাইনে বলবো, TNF direct epithelia, TNF direct epithelia to increase tight junction permeability. TNF direct epithelia, 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 TNF direct epithelia to TNF direct epithelia TNA direct epithelia, TNA direct epithelia or TNA direct epithelia to increase permeability of the tight junction, which activates innate and adaptive immune response. Which drugs? Which drugs antagonize? Which drugs antagonize? Which drugs antagonize TNF? Which drugs antagonize? Antagonize TNF. Infliximab, adalimumab, and Sartolizumab, CIA. Infliximab, and adalimumab. Adalimumab. এটাই মনে রাখা কষ্ট। Infliximab, adalimumab, Cetrolizumab, mumab, MUMAB. Infliximab, ম্যাব, সবগুলোর পিছনেই আছে ম্যাব, 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 ম্যাব। এটার আগে আছে ইনফ্লিক্সি, ইনফ্লিক্সিম্যাব, এডালিমু, এডালিমুম্যাব, infliximab, adalimumab. What is the mechanism of action of these drugs when they are used? They are monoclonal antibody. Infliximab, এগুলো হচ্ছে they are monoclonal antibody to TNF alpha. They are monoclonal antibody to TNF alpha. They are monoclonal antibody to TNF alpha. Block the inflammatory process responsible for the condition. Block the inflammatory process. They are monoclonal antibody to TNF alpha and block the inflammatory process responsible for the condition and block the inflammatory process, interrupting immune system signals involving in inflammatory process that result in tissue damage. Okay, এতটুকু বললেই হবে। When to use them? What is the mechanism of action of this drug? They are monoclonal antibody to TNF alpha, and they block the inflammatory process. They block the inflammatory process. Okay. When to use them? Used mainly in steroid refractory. They are used when steroids refractory to ulcerative colitis. Used when steroids refractory to ulcerative colitis for the treatment of extraintestinal manifestation. For the treatment of extraintestinal manifestation, and when they are refractory to steroid treatment. When they are refractory to steroid treatment, used mainly in steroid refractory ulcerative Crohn's disease, and for the treatment of extraintestinal manifestation. The examiner may show you the picture below, and they ask, okay, for example, cobaltistone appearance, creeping mesenteric fat, and so on. So, okay, end of the station. অনেক বড় ছিল। Elodie known to have a ulcerative colitis and on surveillance colonoscopy is found to have a lesion less than 1 centimeter in the sigmoid colon. What is ulcerative colitis? It is a chronic inflammatory disease which involves the part of the colon, all part of the colon, and mostly it involves the rectum. Etiology is unknown idiopathic, maybe immunological, environmental or genetic. Common site rectum. Backwash ileitis. Backwash ileitis is the involvement of the terminal ileum due to long-standing ulcerative colitis with no escape lesion. Treatment protocol. Total pan which treatment would you offer for this lady? Total proctocolectomy with end ileostomy. Total proctocolectomy with end ileostomy. Because whole colon is susceptible if it is metastasis to liver M1, microscopic ulcerative colitis পাওয়া যাবে crypt abscess and crypt abscess and inflammatory cell, crypt abscess and inflammatory cell in lamina propria, and Crohn's disease non-caseating granuloma, non-caseating and granuloma with epithelioid, non-caseating granuloma with epithelioid cell and Langerhans cell, non-caseating granuloma with epithelioid cell and Langerhans cell. What do you see in the colonoscopy in ulcerative colitis? Ulcerative এখানে থাকবে pseudopolyp, superficial ulceration and contact bleeding. Pseudopolyp, superficial extensive ulceration, contact bleeding, and Crohn's disease থাকবে cobblestone appearance, aphthous ulcer, and thickened bowel. What is the prominent clinical feature of ulcerative colitis? Abdominal pain, crampy abdominal pain, diarrhea, tenesmus, and bleeding per rectum, extraintestinal manifestation, and complication, toxic megacolon, intestinal obstruction, perforation, fistula formation, abscess, abscess, malabsorption. Malabsorption. Why does patient have diarrhea? Because of malabsorption,
হ্যালো
intestinal motility, and infection. জি
হ্যালো
জি আপু।
হ্যাঁ ভাই কি করেন আমি একটু ফোন আসছিল এই জন্য
আচ্ছা
বুঝতে
আচ্ছা,
পারি
অসুবিধা নাই, এটা পড়া হয়ে গেছে, জাস্ট ওই র্যাপিড একবার দেখে চলে যাচ্ছে, পরে পরেরটা যাব। Why does this patient have diarrhea?
malabsorption increase motility
Infection.
infection
Infection, yes. Then the patient underwent terminal ileal resection for Crohn's disease, but still have the diarrhea. Why? Because of
why এটা
relapse,
হচ্ছে
malabsorption,
relapse
and
malabsorption
short bowel
short
syndrome.
bowel syndrome
Hmm. Why this patient of Crohn's disease are more susceptible to renal stone? Because of malabsorption, there is increased intestinal fat which binds with the calcium, and there is more oxalate in urine, hyperoxaluria. Extraintestinal manifestation of IBD in the skin, pyoderma gangrenosum, erythema nodosum, eye, anterior uveitis, iritis, it is scleritis, conjunctivitis. In
তারপরে লিভারে হচ্ছে স্ক্লেরোসিস কোলেনজাইটিস জয়েন্ট আর্থ্রাইটিস আদার্স এর মধ্যে হচ্ছে ক্লাবিং অ্যাপটাস আলসার
aphthous ulcer is most common extraintestinal manifestation: arthritis. Investigation:
আর্থ্রাইটিস
full blood count, necrocytic anemia, stool,
ফুল ব্লাড
occult blood,
স্টিল অ্যান্ড
fecal occult blood or fecal calprotectin, and barium follow through X-ray, CT, prothrombin time concentration, can cause a vitamin D deficiency, and to detect vitamin D, colonoscopy, but not in acute phase. Vitamin deficiency susceptible: vitamin A, D, E, K, and B12. How do you treat? Firstly, lifestyle modification, food modification, advice from the gastroenterologist, and medication such as steroid, antibiotics as per trust policy and microbiologist, 5 amino salicylic acid, and immunomodulators. Thirdly, surgery. If it is not responding to medication, then surgery. What are the indication of the surgery? Toxic megacolon, intestinal obstruction, perforation, fistula formation, abscess, refractory disease. What is TNF? It is a TNF. TNF is pro-inflammatory cytokine released from the macrophage.
released from macrophage causing high fever, high inflammatory marker, and anti-tumor effect.
Yes.
তারপরে হচ্ছে ফাংশন অফ
Function:
টিউমার নেক্রোসিস ফ্যাক্টর
activation
অ্যাক্টিভেট
of the
ম্যাক্রোফেজ
macrophage and neutrophil, active cofactor for the T cell,
সেল
and antitumor
মিডিয়েট
effect, similar effect of interleukin 1.
ইন হচ্ছে জার্ম সেপ্টিসেমিয়া অ্যান্টি-টিউমার ইফেক্ট
What is the rule of
রোল অফ
inflammatory bowel
ইনফ্লামেটরি
disease?
বাউল
TNF directs
টিউমার
epithelium to increase tight junction permeability, which activates innate and adaptive immune response.
junction permeability which increase the flux of luminal bacterial components which activates innate and adaptive immune response.
Which drugs we can give? Infliximab and adalimumab. Infliximab, adalimumab.
Sarclizumab.
Mechanism: they are monoclonal antibody to TNF alpha and block the inflammatory process. When to use them? Used mainly in steroid refractory ulcerative colitis cause and for the treatment of extraintestinal manifestation.
পরে লাস্টের একটা কোশ্চেন ছিল
ওই যে ছবিগুলা
হ্যাঁ ওইখানে ওটা বলতে হবে যে ওই যে ক্রোনস ডিজিজের ফিচার, কোবেলিস্টোন অ্যাপিয়ারেন্স, ক্রিপিং ম্যাজেন্টেরিক ফ্যাট, তারপরে হচ্ছে থিক এন্ড বাউল ওয়াল, অ্যাপটাস আলসার, লাইনার ফিশন।
লিনিয়ার ফিশন।
এখন কোনটা পড়বেন? ও ভাইয়া, ওই যে স্যারের গ্রুপে একটা হচ্ছে আর একটা আছে না, নোট গ্রুপ আছে না?
হুম হুম
ওই নোট গ্রুপে ওই ছবিগুলা দেওয়া আছে নাকি, আপু তাই বললো।
আমিও কালকে রাতে ওগুলো দেখলাম, ওই ছবিগুলা, কিন্তু মূলত এগুলো এখন পড়াও তো মুশকিল। দেখতে হবে অ্যানাটমির, বিশেষ করে অ্যানাটমির ছবিগুলো দেখাই লাগবে।
হুম। এরপরেরটা কি, ফ্যামিলি অ্যাডেনোমাটাস?
নেজোফ্যারিঞ্জিয়াল কার্সিনোমা, কার্সিনয়েড, আইবিডি। এফএফপি। এরপরটা হচ্ছে ফ্যামিলিয়াল অ্যাডেনোমাটাস পলিপোসিস। You are discussing the result of a follow-up colonoscopy with a young lady. She is very concerned because her father died of colon cancer at young age. What can you see in the colonoscopy image? Multiple polyps that varies in size. Multiple polyps that varies in size. What you can see in the colonoscopy, multiple polyps in variable size. What is the most probable diagnosis? It is familial adenomatous polyposis. Where else would you expect to find polyps other than colon and rectum? Colon এবং rectum ছাড়া আর কোথায় পাওয়া যেতে পারে? The stomach and duodenum. Stomach and duodenum. Stomach এবং duodenum FAP পাওয়া যেতে পারে। Define FAP. It is a autosomal dominant condition. Autosomal dominant condition. Autosomal dominant condition characterized by loss of antigen presenting cell tumor suppressor gene, or it is the autosomal dominant condition characterized by loss of APC tumor suppressor gene, loss of APC tumor suppressor gene, loss of APC tumor suppressor gene on the long arm of chromosome number 5. Again, it is a autosomal dominant condition characterized by loss of APC, loss of APC in long arm of chromosome number 5, loss of APC suppressor gene on long arm of chromosome number 5, AD, leading to development of hundreds of, এর কারণে কি হবে, leading to development of hundreds of tubular adenoma, leading to development of hundred of tubular adenoma, leading to development of hundred of tubular adenoma, leading to development of hundreds of tubular adenoma with 100% risk of cancer by the age of 40, with 100% risk of, okay, with 100% risk of cancer by the age of 40. তাহলে it is a autosomal dominant characterized by loss of APC tumor suppressor gene on long arm of chromosome number 5. As a result, development of hundreds of tubular adenoma with 100% risk of developing colon cancer by the age of 40. Function of APC tumor suppressor gene. Function of APC tumor suppressor gene encodes a factor that negatively regulates the WNT pathway in colonic epithelium by promoting the formation of a complex that degrades beta carotene. Function of APC tumor suppressor gene. It negatively regulates WNT pathway. Function of APC gene. Function of APC gene negatively regulate the WNT pathway in colonic epithelium. Okay. Can you name other inherited genetic colon cancer syndrome? Can you name other inherited genetic colonic cancer syndrome? Can you name other inherited? Can you name other inherited genetic colon cancer? Can you name other inherited genetic colon cancer? Lynch syndrome, Fitzsimmons syndrome, Cowden syndrome. Lynch syndrome, Fitzsimmons syndrome, and Cowden syndrome. Can you name other inherited genetic colon cancer? Inherited genetic colon cancer. Inherited genetic colon cancer. আচ্ছা কি? Fitzsimmons syndrome, Lynch syndrome, Fitzsimmons syndrome, and Cowden syndrome. What is the classification of intestinal polyp? Non-neoplastic polyp and neoplastic polyp. Non-neoplastic polyp and non-cancerous are cancerous. Non-cancerous or non-neoplastic polyp and neoplastic polyp. Non-neoplastic এর ভিতরে আছে hematomas, metaplastic, and pseudopolyp in ulcerative colitis. Hematomas, metaplastic, pseudopolyp. Non-neoplastic এর ভিতরে আছে MPH. Non-neoplastic হচ্ছে MPH. Metaplastic, non-neoplastic, metaplastic, pseudopolyp, and hematoma. And neoplastic এর ভিতরে আছে volvulus, tubular, tubulovolvular, volvular, tubular, tubulovolvular, BT-TB, volvular, tubular, tubulovolvular, অথবা villus, villus, tubular, tubulovillus. তাহলে নন নিওপ্লাস্টিক হচ্ছে মেটাপ্লাস্টিক, সিউডোপলিপ, হেমাটোমাস। আর নিওপ্লাস্টিকের ভিতরে ভিলাস, টিউবুলার, টিউবুলোভিলাস। ক্যান ইউ নেম সিন্ড্রোম উইথ হেমাটোমাস পলিপ? পিটজিগার syndrome, Pitt-Seeger syndrome, hematomas polyp with Pitt-Seeger syndrome, hematomas polyp with Pitt-Seeger syndrome. Define hematoma. Focal or multifocal malformation. Focal or multifocal malformation composed of haphazard arrangements of different amount of tissue that are normally present in the organ. Focal or multifocal malformation. Focal or multifocal malformation composed of haphazard arrangement of different amount of tissue that are normally present in the organ. Example, hemangioma and Pitt-Seeger syndrome. Pitt-Seeger syndrome এ থাকবে হেমাটোমা। হেমাটোমা কি? হেমাটোমা হইতে পারে এখানে একটা ফোকাল অথবা মাল্টিফোকাল। ফোকাল or মাল্টিফোকাল এটা হওয়ার কথা না, সুতরাং এই malformation. Focal or multifocal malformation composed on a haphazard arrangement, যেটা যেখানে খুশি। তাহলে focal or multifocal malformation composed of haphazard arrangement of different amount of tissue that are normally present in the organ. Okay, that are normally present in the organ, different amount of tissue. ওইটা নিয়ে focal অথবা multifocal haphazard arrangement, এটা হচ্ছে hematoma. What are their complication? কমপ্লিকেশন অফ হেমাটোমা এটা করতে পারে ইন্টারসাসেপশন, ইন্টেস্টিনাল অবস্ট্রাকশন, কমন ইন্টারসাসেপশন, ইন্টেস্টিনাল অবস্ট্রাকশন, ম্যালিগনেন্ট ট্রান্সফরমেশন, ulceration and bleeding, electrolyte disturbance like hypokalemia. তাহলে intestinal obstruction, intussusception, malignant transformation, ulceration, bleeding and electrolyte disturbance like hypokalemia. What are the features? What are the features increasing the risk of malignant change in the polyp? What are the features increase the risk of malignant change in polyp? Type of what are the features increase the risk of malignant change in polyp? In villus 40%. What are the features increase the risk of malignant change in polyp? If it is a villus, then 40% will change into malignant. Diameter of the adenoma, if it is less than 1 centimeter, chance is 5%. If more than 2 centimeter, 20%. And degree of dysplasia, তাহলে তিনটা, একটা হচ্ছে টাইপ অফ অ্যাডিনোমা, diameter of the adenoma, if একটাই মনে রাখবো, diameter of the adenoma, if it is less than 1 centimeter, chance is 5%. If it is more than 2 centimeter, chance is 20%. 20% chance. Less than 1 centimeter, 5% chance. Less than more than 2 centimeter, 22 to 20. Okay, and degree of dysplasia, and if it is villus, then 40% chance of malignant transformation. Describe the sequence of events in malignant transformation of the adenoma. কি করে হবে? Stepwise accumulation of mutation of oncogene and tumor suppressor gene. Oncogene and tumor suppressor gene এর stepwise accumulation এর কারণে adenoma থেকে হবে adenocarcinoma বা malignant transformation. প্রথম কি? Loss of tumor suppressor gene, এটার কারণে হবে hyperplasia. Then loss of proto-oncogene mutation অথবা proto-oncogene mutation এর কারণে হবে dysplasia, hyperplasia, dysplasia থেকে হবে তারপরে adenocarcinoma. Loss of P53, এটা একটা টিউমার সাপ্রেসর জিন, তাহলে দুইটা টিউমার সাপ্রেসর জিন আর একটা proto-oncogene, টু ফিট হাইপোথিসিসের মতো টিউমার সাপ্রেসর জিন. ওকে, loss of APC, APC will cause hyperplasia. Loss of proto-oncogene, loss of APC will cause hyperplasia. RAS, proto-oncogene mutation, dysplasia, and P53 tumor suppressor gene will cause adenocarcinoma. P53 tumor suppressor gene will cause adenocarcinoma. তাহলে hyperplasia, dysplasia, hyperplasia থেকে dysplasia, dysplasia থেকে adenocarcinoma. Again, loss of APC will cause hyperplasia. Then KRAS proto-oncogene will cause dysplasia, and loss of P53 will cause adenocarcinoma. What is the proto-oncogene? What is the proto-oncogene, oncogene and tumor suppressor gene? Proto-oncogene, oncogene and tumor suppressor gene. বড় বড় expression এটা হচ্ছে না. Proto-oncogene